This is Zandra Pollard. It's Where I Am. I want to thank my 91.5 and more listeners for tuning in. Today, my guests are Nikita Dove and Dr. Sanda Morar of the Oncology Institute in Henderson. So thank you both for being here today.
You're welcome.
Thank you. And we're gonna just jump right in. It is Breast Cancer Awareness Month, and we wanted to bring some information to you all so that you know how you can take care of yourself, do some preventive measures, what to do, how to do if you are diagnosed with breast cancer and the such. So I invited Nikita here because she is a breast cancer survivor. And I'd like for you to start by telling us your story. What happened when you first said, oh, I think I better make an appointment to see the doctor because something doesn't seem right?
My daughter's a massage therapist, and she would massage me, and in my right arm it would be pretty stiff and a little sore, which was not a normal thing for me. And I kept telling her that Mommy's really tight up in there. Why am I so tight? So she says, maybe you should have it looked at. And so I thought I was okay. And I went to Africa. And when I went to Africa, I was there for a month, but I was moving around. I was in apartments and in hotels, and I went from 3 suitcases to 9 suitcases. And so I thought that maybe the suitcases were starting to make me feel even more sore.
Right.
So I started pressing on my breasts. And when I started pressing, I started feeling these little knots. And as the week went on, the knots started as if they coagulated into each other because they got larger. So I asked my daughter, I said, can you feel that? She says, yeah, Mommy, I think you need to go and have that looked at. And again, I said, oh, it's probably just the suitcases. You know, we're lifting
How
all those
far were
suitcases.
you into your trip when you noticed the lumps or the nodules?
I think I had probably about 3 days left.
Okay, so you were pretty much on your way back home.
Yes.
Okay, and so then you get home, and then what happens? Did you call the doctor right away, or what was the process?
Well, that was my intention to do. But when I got home, you know, I started looking at my mail because I was gone a month. And in the mail, I had a letter for my mammogram, which was going to be like a week later. So I said, well, I'll just keep that appointment and I'll go then.
Okay, so you had a mammogram coming up.
Yes.
Okay, so you go to your mammogram, and then what happens?
She says, in the mammogram, it showed some abnormality in your breast. So we're going to do an ultrasound. And the ultrasound is something that I guess picks up a little bit more than what the mammogram does. So I was like, okay. But I got a little nervous because I'm like, I went back to thinking about what I was feeling. And I'm like, well, that's probably all of that stuff I was feeling earlier. So when she came back in, she says, there is something there. We're not sure what it is, and it seemed to be something small. So we're going to take a biopsy. And in the biopsy, it will tell us more about what's going on.
Was this all in the same day?
It was all in the same day.
Okay, so that had to be kind of frightening.
It was very frightening.
Yeah, and were you there alone?
No, my husband usually goes with me, but he was in the other room.
Okay.
Yeah.
So they were just taking you from room to room.
Right.
And so what were you feeling?
I just kept going back into that feeling of like in the earlier the month, I was feeling tight, and I had told my daughter that Mommy's tight there when I'm normally not.
But you weren't thinking like, oh crap, this might be something serious.
After I did the mammogram, I knew it was something serious.
Okay. So, Dr. Morar, it is Breast Cancer Awareness Month. So a lot of ladies are out there getting, their mammograms done for the year. Is it typical that you should get your mammogram every year? Is it different if you're older? And what is it for men? What should men do?
Sure. The mammogram remains the standard screening tool that is recommended by American Cancer Society, the National Comprehensive Cancer Data, and picks the abnormalities in the breast 1 to 2 years earlier before any masses can be felt, palpated in the breast or under the arm or in the axilla. So mammogram, yes, as recommended as standard of care, it's described it's once a year and should start at age of 40. There are some stipulations that after age of 55, if everything had been okay, you can just continue to evaluate every 2 years. But in the main sites, as the NCCN guidelines remain once a year follow-up. Ultrasound, it is used when suspicious lesions, which appears on the mammograms like microcalcifications, little in duration, little thickening can appear for better view. And the results of mammogram guide the next step. Male breast cancer, we jump to a different category. It is rare, as for example, in 2019, per 100,000 women, they were diagnosed about 260,000 breast cancers in females and 2,600 in male. The male breast cancer evaluation and treatment kind of follow the female pathway of diagnosis and treatment. They had not been studies because it's rare. It's more aggressive in male. The mammograms in male is not established as a way of evaluation. The point of interest is if a lump a male feels in the breast area needs to be evaluated and removed.
So men need to do that breast check as well.
Yes, the
Okay.
breast check is a very important step for both male and female, but male, this is what they have to go for by.
Okay, well, Dr. Marar has been in this business for over 30 years. Is that correct?
Yes.
Yes, and you look great.
1999.
You
Thank
look great.
you.
I would have no idea that you have been doing this for so long. But, thank you for what you do. And please tell our viewers and listeners where you are located.
Yes, I am representing the Oncology Institute of Hope and Innovation. It is based in California, South California, with offices there, about 55 oncologists in that area. That's the hub, we
Okay.
call it, of our practice. South California with Whittier and San Bernardino. I'm not very familiar with South California. We have Nevada satellite, and then Arizona satellite with 5 offices, and in Nevada 3 offices. In Nevada we have one office in North Las Vegas, across Mountain View Hospital on Cheyenne and Tenaya Way. Then in Spring Valley, right by Spring Valley Hospital on Rainbow and Hacienda. And in Henderson, which is right by St. Rose Dominican in Del Webb Medical Plaza on the Eastern Avenue.
Okay, so you're practicing in California and in Nevada.
Not me.
Not you, but
I am, yes, my practice route is in California. Dr. Agajanian, it's the founder of the practice, and his wife, Hilda Agajanian, are the founders of the practice, and it's growing rapidly with good representation of good oncology care.
Gotcha. Okay, well, so now let's get into the types of cancer. First, I'll ask you, Nikita, what type of cancer did they find?
It was a hormonal cancer.
And doctor, how many different types of breast cancer are there?
Yes. So breast cancer can start in the ducts and of the ducts of the lobules of the breast. So we have ductal carcinoma and lobular carcinoma. Invasive ductal carcinoma, that means ductal cancer, it's about 85% of the cases, the most common type of breast cancer. And then we have the lobular invasive carcinoma, so about 15% of breast cancers. The same type of treatment, some anatomic characteristics, ducts and lobules in the breast, And some features, as lobular carcinoma has a tendency to be bilateral, one presenting in one breast, you suspect that might be in the other breast that you haven't checked or you haven't noticed, and could be multifocal.
Well, that's a lot. You know, the first time I went and got my mammogram, I was pretty excited just because I'd never done it before and it was my first time. And there's so much um, advocacy for, getting your yearly mammogram. And so my older cousins, they would call me and say, "Hey girl, you're 40, it's time to get your mammogram." And so when I went down there, I was a little nervous just because it was the first time. And then I got a letter in the mail and it had a name. And I don't know what that name is, and I'm sure that you know. But it said that it just meant that my breasts were dense.
Yes.
And from that, I felt highly complimented.
Yes.
I felt highly complimented. But it meant that I needed to, what does it mean when they're more
Yes.
dense?
So dense breast, it's not very common. Could be it's of course in younger patients. That's why the mammogram starts at age 40. Yet you can find dense breasts at age 55 and up, and it's little tricky as can hide the lesions. So the mammogram alone might not be enough. Mostly if you find some atypical, some abnormalities in the first mammogram that you wonder, even the biopsy that you completed to be safe, it's benign, so non-cancerous, you need to consider in dense breast younger patient another form of surveillance, that is the MRI of the breast, magnetic resonance imaging of the breast. So dense breast is a condition that you need to attentively follow in spite of not having any form of cancer.
So, but what I find weird, I'm thinking back on your story, Nikita,
Mhm.
and you said that you were getting your mammograms every year.
Yes.
And nothing was detected until right before.
Well, no. When I had it done when I had a mammogram on my left side, because she said my breasts were large and indensed, that
Oh, yours were
they
dense too.
yeah.
Okay.
You actually got that. Anyway, so she said we wanted to go a little farther, and that was the imaging that you were talking about. And they found, I guess, a nodule or whatever,
Mhm.
and they removed my nipple and took it out, but it was benign.
Okay.
But that was a couple of years before I actually had the breast cancer on this side. So when I did get that call again, I was just before I got the call, I was like, oh, it's probably gonna be that like that one and be benign, but it
Okay.
wasn't.
So take us back to when you found out that you indeed had breast cancer,
Mhm.
and then it was time for treatment. What was that phone call like?
Um, she said I would get the call between 3 and 5 days. So after the third day, I got really nervous. But then I started looking at it and I said, maybe the longer it is, meaning it's nothing.
Mhm.
And my daughter and I were in the kitchen and the call came. And she says, I'm so sorry that I have to say that the results came back as cancer. And I sat there for a minute and I said, oh, okay. Okay, okay, I can handle that. But I really couldn't. But that was just the first thing that came to my mind. The second thing came to my mind is my children, because I didn't know how I would present that to them. And then, when you hear cancer, you're like, well, am I going to survive? I don't know much about it, but I've heard from other people, there's certain types, like the doctor said, but I wasn't sure which type I had yet. And I know that my girlfriend who had triple negative was not a good one. So I was worried if I had that. Then I was worried about what would I tell my children and how would I tell them without them getting upset or whatever.
Mhm.
And then I thought about, well, I need to tell my husband too, and he wasn't there for the whole day.
Oh wow.
So I held it, and because my daughter was in the kitchen with me, she consoled me and was like, Mama, you're going to be okay. It's going to be okay.
Um, I'm so sorry to hear about your experience, but you survived.
Yes, I did.
You survived.
Yeah.
And so thank you for sharing your story with
No
us.
problem.
But I also wanted to ask you both about support groups. Were you involved with the support group, Nikita? And Dr. Morar, when she finishes answering, can you please let us know about any community support groups in our Las Vegas Valley?
I looked for some, but I really didn't find what I was interested in. So I started researching myself. So I started interviewing women that had breast cancer, that had their breast removed, like me. What were their procedures? How did they deal with it? What did it feel like having someone to talk about it with? And what if they felt that they didn't need it? With me interviewing the women, I got up to like 15 women. And in those 15 women, it gave me so much information that I wish I had at the beginning of my cancer, because it would have made me able to go that road, which would have been a better suggestion because I had that information, as opposed to reacting because I'm afraid, or
Right.
I don't want to say the word die, but if I were to prevent from dying, what would I do? Or even with the um, after effect, when they do the cosmetic look. When I lost my breast, it was not a nice look to me. So I'm like, well, what is my husband going to think? Is he going to still love me the same?
Mm-hmm.
And so I needed to hear that from other women. What did your husband feel like when you lost your breast? What was he like to you? What are your children going to think when they see you undressed and you no longer have that look? So with me listening to the other women and talk, it made it better for me.
So you had a good family and friend support.
Yes, I did.
But what about those, Dr. Moore, who internalize things more, who are not able to share and need to find a resource to help them?
Yes, the main resource, the main site that you need to access is American Cancer Society. Not good representation of established support group in Las Vegas area. I learned for the past 2 years that I'm here. The support group, you'll be the patient will be advised through the American Cancer Society for different links. They're more virtual than in presence.
Okay.
Unfortunately, I feel that I owe you more details, as she was throwing in triple negative and
Sure.
hormonal positive. So we understand from Nikita that she has a breast cancer that was fed by the estrogen production in her body. This is called estrogen receptor positive, progesterone receptor positive. It's one of the nicest breast cancer, if we can
I like
put
that word.
nice and breast cancer together.
Mm-hmm.
Yes,
Mm-hmm.
mostly that another receptor, HER2, it's negative, which I understood from Nikita our prior with prior conversation that is the case. The immediate treatment after the biopsy establishes a diagnosis is surgery, which is lumpectomy, which is means a part of the breast is removed. That is followed by radiation to consolidate the local treatment, or mastectomy, and if the tumor is less than 2 inches or 1.75 inches, no need for radiation is needed. At the time of surgery for mastectomy, reconstruction can be initiated at that time with expanders placed under the skin to stretch the skin for implants to come in later, or you can have implants reconstruction completed 6 months later. Gene testing on the breast tissue that had been removed, that is cancer, disclosed the benefit of chemotherapy or hormonal therapy alone or in combination. Nowadays, not everybody needs chemotherapy for breast cancer. Nikita didn't.
Right.
She is taking hormonal treatment, endocrine treatment. That means she's blocking the production of the estrogen in her
Yes.
body. And the genetic test disclosed the benefit of 5 years versus 10 years of one pill a day to control the cancer recurrence. She mentioned triple negative. Other types of breast cancer, depending on the cell of the breast cancer evaluation are breast cancer that they don't the cell that does not represent any receptor through the analysis. No estrogen receptor, no progesterone receptor, not HER2. This is the triple negative, more aggressive, or estrogen receptor positive but HER2 positive, which will be determined for another type of treatment, no chemotherapy, immunotherapy, biological therapy nowadays, treatment that will extend to 1 year together with the pill that will block the estrogen blocker. So the pathologic analysis, the time when you meet with the oncologist after surgery is done, it's crucial because based on the pathology report, evaluate the size of the tumor, the lymph nodes presence, positive of cancer or not, and the characteristic of these receptors of the breast cancer cell that will dictate, based on the national guidelines of treatment, the best treatment for the specific patient. So the treatment is quite individualized.
Yes, I'm sure. And so I was hearing that you were talking to quite a few friends who had gone through this process.
Friends and referrals.
But every situation is different,
Yes.
right?
Yes.
So everyone's story is different, but there's always something you can pull from someone else's story to help strengthen
Right.
yourself, right?
Yes.
So, and what I've heard from you, Dr. Morar, is there is not a support group out here in Vegas, that you referred to sites. And so I want to let my listeners know, if you'd like to start a support group or if you know of a support group, please go to my website, itswhereiam.com. Let us know where people can find support groups for breast cancer or any type of support group, because this program is designed to feed and give you the information so that you are knowledgeable and know how to move forward in your own life. And we all have shared experiences. You are not alone. So please go to the website, itswhereiam.com, and any information that will be helpful in regards to breast cancer or any type of support group, please leave those comments there.
I just want to add that Las Vegas area is developing a nurse navigator program.
Okay.
Mountain View has a strong nurse navigator program. Sunrise Hospital, so HCA system that I am aware with that, and I work closer. And the support group can be created as such, with a nurse navigator being like the follow-up of the symptoms,
Sure.
the pulling Nikita into survivorship. Survivorship describes support group. What do you do after?
Right.
What are you going to do with your life? What is going to happen 5 years later? We have to be mindful of bone health. Taking this estrogen blocker treatment, 1 in 4 patients will develop muscle aches, joint aches. We can switch the pills around, no problem there. But 10%, 1 in 10 women taking this type of medications will have a thinning of the bone. So we need to do a bone density test, a DEXA scan, once a year to see if the bones are going to be thinning out. It's thinning out at age 35 and up for any of us ladies.
Yes.
I think I feel that.
It's very easy to treat. It's vitamin D, calcium, and then a pill a month, or an infusion every 6 months, or an infusion every year. You heard about Reclast or Prolia or Fosamax. That's the pill. So it's more to the patient. The treatment and the follow-up from the oncologist standpoint doesn't end. I'm done with the treatment, goodbye. You see the patient once a month. You see the patient every 2 months, every 3 months, physical exam, and then it's bone health, cardiac health.
Okay.
And bone marrow health as the counts health. So it's cancer patient, breast cancer patient is a complex patient. You see the patient as a whole individual. So you are going to have hot flushes, you are going to have dryness. So there are lots of things to take care of once you are in remission. And you have to follow up any evidence of recurrent disease. So
Can I say something?
Of course.
That's funny you said that, because when I was having all of those symptoms, I was like, no, you don't want to tell. I feel like that.
The oncologist. You tell everything
Well,
the oncologist.
I wasn't sure if it was blended in with that because
Yes.
like the dryness, it was like, no, why am I
Yes.
feeling like this? I didn't associate that with.
We can fix it.
Yeah.
We can fix it. We can make everybody happy.
Okay.
All right. Sounds good. So, Nikita, did you want to tell us about what you're doing now that you are in remission?
Well, I started a journey with my cancer because, like I said, I had so many questions, and I have an oncologist, but there are sometimes some things you're not sure if you're comfortable to tell your doctor about it, but you can tell your girlfriend.
Yeah.
Or you can say it to somebody that maybe gone through it and they understand it, but then you have to find them. So what I've started doing is I've started interviewing women, and I'm going to compose that into a book of all of the things and questions you want to know about cancer.
Very nice. But oncologist, you just go to your oncologist, or Nurse Navigator sooner, a bigger program in Las Vegas, and we're
And then-
here
and then
to
I
help
thought-
you.
I thought because my oncologist is like 26 and I'm in my 60s, I was like, she probably
Yeah,
wouldn't even
really.
feel that.
Yes,
Yeah.
we know. We see
Okay.
enough. We see enough patients every day that we feel that we have all the cancers that we've taken care of. So
So, if
Thank
you
for
feel
sharing
more
that.
comfortable telling your girlfriend or your husband, you still got to transfer that information to your oncologist because that is the
Yes.
person who is going to be able to help you.
Right.
If you feel good in the moment and you need that sense of relief by telling a girlfriend, that's great. But
Yeah.
please give that information over to your
Okay.
oncologist.
just write it down and push the paper towards.
I have a good rapport with my oncologist, but in the beginning, I wasn't sure how to approach it because, like I said, she was so much younger than me,
Yeah.
and my girlfriends that have gone through cancer,
Sure.
I felt more comfortable talking with them. But I still do talk to my oncologist.
Very nice.
But that's important. I thank you for sharing that because, everyone isn't so open
Right.
to talk to anyone. Sometimes
Exactly.
we don't even have a friend
Yeah.
that we want to confide in about our personal situations. And so that's why we're doing the show. This is why It's Where I Am brings this information to you. I want to thank all the listeners for tuning in to 91.5, Jazz and More. And just a little reminder, go to itswhereiam.com. You can go to itswhereiam.com. You can see this show. You can see previous shows. And that will take you straight to the YouTube channel. And so you would need to subscribe there as well. We want everyone to be informed. We want people to comment because our listeners are hearing what we're saying. People are watching and people are listening. And whether they do that today or tomorrow, that information is out there for you. And we want to be a source of information for you out there. So again, I want to thank my guests for being here today,
Thank you.
Nikita Dove and Dr. Morar. And, also, you can find Nikita if anyone else wants to be interviewed or find out about that book. She is at Kitty Dove on Instagram. That's at KITTIEDOVE.
That's me.
And this is Andra Pollard. Thanks again for listening. I'll see you the second Saturday of next month. I believe it's November 14th. We'll see you then. Thanks for tuning in.